While appearing before the Public Accounts Committee on Monday, Permanent Secretary of the Ministry of Health, Malcolm Watkins, in conjunction with his team, stood ready to answer questions thrown at them in relation to the findings of the 2016 report by the Auditor General of that agency. The first inquiries stemmed from paragraph 445B of the AG's report, which stated that a sum of $320 million was included as part of a $1.8 billion award, which represents warrants received by the Ministry for Region Number 6. While it was stated that the full sum was expended by the Ministry on behalf of the region, it was also noted that the money was not spent for the intended purpose, as $206.2 million was expended on the Ministry's payroll for October 2016, while the remaining sum of $114.3 million was used to purchase drugs and medical supplies, which was the intended purpose for the entire sum of money, totaling $320.5 million. In his response to the issue, the Permanent Secretary posited that engagement with the Ministry of Finance is ongoing to bring a resolution to the issue with regard to the amount expended for the payroll. Meanwhile, paragraph 457 of the AG's report highlights that the construction of an infectious inpatient facility at the Port Kaituma Hospital Complex in Region 1 was awarded to the lowest evaluated bidder to the tune of $40.9 million against the engineer's estimate of $47.5 million. It was further revealed that the contractor received an advance payment of $10.2 million, representing 20% of the contract sum, and that as of December 31, 2016, payments totaling $39.9 million were made to the contractor. It was noted by the AG's office, however, that at the time of the physical verification on the 30th of August 2017, approximately 1 year after the contracted completion date expired, that works to the complex were still incomplete and that the contractor had removed from the site. It was noted that no approval for extension of time was granted, but that the contractor received a total payment of $39.9 million, or 97.5% of the contract sum, for incomplete works. And according to the scope of the project, works totaling $8.6 million were not performed. The former Permanent Secretary, in responding to the discrepancy, made it known that the Ministry is working with the Auditor General's office and the project consultant to have the matter rectified.
We have been working, we have made contact with a consultant who has provided some help, particularly as related to 457. And I think this is a matter we're discussing with the Auditor General's office with a view to bring some further clarity on the present position.
Wendell Badrie reporting for the HGP Nightly News.